Welcome back. The time is now 7:14. One of the first things women do when trying to get pregnant is find an OBGYN doctor. But even before that, your primary care physician could play a critical role. With January being Birth Defect Awareness Month, Dr. Skylar Williams from Touro joins us to talk about why women should consult their primary care physician when planning for a family. Good morning, doctor. How are you doing this morning?
I'm doing great. Thank you so much for having me.
So I know when we talk about the term birth defect, it can mean a lot of different things, and it can mean a lot of different situations, if you will, with babies. But I guess let's backtrack a little bit and kind of give a better definition or explanation of what exactly qualifies as a birth defect.
Yeah, that's a great question. Birth defects are any health condition that are present when a baby is born. These can present sometimes as physical changes to the baby, like for example, a cleft palate, or sometimes they're more subtle, like a heart condition that may take time to identify in the baby. Some birth defects are minor and can be corrected by surgeries. Others are more severe and can impair how the baby grows and develops.
And Dr. Williams, we talked about how a lot of women are often looking for an OBGYN once they're pregnant, but you and I were talking in the commercial break, there should be some steps taken even before then, and a term called preconception care. Tell us what the idea of preconception care is exactly.
Yeah, preconception care refers to medical care that is delivered to a woman ahead of a pregnancy that has been statistically shown to increase the chances of having a healthy baby and a healthy pregnancy. This care is really important because while some birth defects happen at any stage of pregnancy, the majority of birth defects occur within the first 3 months of the pregnancy, which is a crucial time of development for the baby. So if you're planning to become pregnant, taking certain steps can reduce the risk for you and your baby.
Dr. Williams, about a minute left here. If you were to plan a preconception care visit with your doctor, what would that visit look like exactly? Or what would those visits look like exactly?
Yeah, during these visits, you can expect your provider to, one, review your personal medical history and current health conditions and make sure they're all optimized for a healthy pregnancy. Two, they'll review your medication list to be sure you're not taking too much of any medication or too little of any medication as well. And lastly, review your immunization history to make sure your immune status is up to date for a healthy pregnancy.
Well, Dr. Williams, hopefully this is something that's at least piqued some people's, not necessarily interest, but kind of something on their brain if they're considering getting pregnant, starting to have those conversations with their doctors now before they even talk to their OBGYN. We appreciate your time this morning.
Okay, thank you so much for having me.